simple. Our algorithm is very simple. Now, if the patient comes into the emergency department and the troponin level is below the LOD, then you look at the pain-free time. If the pain-free is more than 6 hours, you can send this patient home. Thank you, ma'am. You can send this patient home immediately. Now, if the pain-free is less than 6 hours, repeat one more at 3 hours. If at 3 hours the troponin level is still below the LOD, you discharge the patient and then consider the patient to be included for differential diagnosis. Now, if the patient comes to you with a troponin level below the cutoff value, gender-specific cutoff value, but above the LOD, then you still look at the pain-free time. If it's more than 6 hours or less than 6 hours, please do a retest at 3 hours. At the retest, if there's no significant high-sensitive troponin I level, then discharge the patient, send the patient for other investigations. Now, if the troponin level shows significant changes, meaning that, one, if the second draw is above the cutoff value, or two, there is RCV change of more than 50%, please admit this patient for further invasive management. Now, the third point is, if the patient comes to you and the first draw is above the cutoff value, and the second draw is, which is taken after 3 hours, has no significant changes, you don't have to be alarmed. If there's no significant changes, then let us consider other causes of troponin elevated because of injury to the myocardial infarction rather than AMI. And the fourth incident is, if the patient comes to you when the troponin levels are 10 times more than the cutoff value, you would then immediately call the cardiologist for admitting this patient. One draw is good enough. This assay has the ability to be tested in all different tube types. And as far as the prognosis is concerned, if the patient comes back to you after AMI at 30 days and 90 days, if the levels are below the LOD, you're 100% sure the patient is not going to have an AMI, another incident. As the levels are rising, we can give you percentage of risk of this patient having another MACE. But when the level on follow-up is above the 99th percentile, it is significant where the patient's incidence of having another AMI is 10%. So there is value for prognosis as far as this assay is concerned. Another study showing you different quartiles that have been put in a chart to show you the higher the troponin level are on follow-up, higher is the risk of having AMI and another MACE. So bringing the analytical and clinical value together, it is an assay which has a CV less than 6% at the 99th percentile, chimeric antibody added. It has a gender-specific 99th percentile values for both males and female. It is able to detect 96% of all general population. It has a low control target near the diagnostic cutoff values. It has reduced the interval to 3 hours rather than 6 hours for you to make a decision, and it has an upper dynamic range at 50,000 picogram per ml, meaning that if you have high levels of troponin, you don't have to dilute. You can go ahead and report the assay. In summary, the Abbott's Architect high-sensitive troponin I meets all requirements of a high-sensitive troponin assay. Analytical performance is robust, excellent detection of normals. Clinical performance gives you an opportunity for gender-specific cutoff values. There is low end accuracy for non-acute application. Thank you.